And so then what can you look to actually address? Because from some of the things that we've spoken about, for example, if something's happened in early childhood, that can be quite a deeply ingrained element of someone's personality. So is it the kind of thing where you basically look to address the narcissism as a whole, or is it more that you look to address how that manifests in certain ways?
Well, there's a bit of both, and we look at the broader kind of picture. If the person is prepared to follow through with therapy, and that's a challenge because there's something about therapy that can be quite uncomfortable. It involves a reflection on your own behaviour, including ways that you've fallen short of an ideal, and some judicious challenging, often from a therapist. Actually, I will mention that as a therapist, when you see people with narcissistic tendencies, and I've seen quite a number of people in the past, there's a balance between two different things. It's important to offer some kind of affirmation to the person or some kind of encouragement to see the positive qualities in the person, because there's enough that's challenging about therapy in itself that it's hard for people to stay in the situation without some of that, without some experience of being affirmed. But also there needs to be a degree of challenge. If a person's going through therapy with narcissistic tendencies and they're not being at times directly challenged by the therapist, hopefully handled in a thoughtful or sensitive way, but sometimes it might involve some significant confrontation. Unless the person's being challenged in some way, they're not likely to address these underlying patterns. But there are some broad patterns that we look to work on, and there's some more specific things. The first thing is we'll acknowledge the problem that the person's come with, and it might be depression or an addiction or some other kind of behavioural difficulty. It might be ways of dealing with anger, and so that will be some of the primary focus. But if we identify some of these narcissistic patterns that might contribute to or fuel those problems, then we might look to draw that out as well, or acknowledge some of those patterns as being contributing factors. So then the broad things that we're looking at is it's helping the person allow themselves to be ordinary, not have to be special in different kind of ways. So it's challenging that notion of grandiosity. It's addressing the lack of empathy. So helping the person put themselves more into other people's shoes, considering more others' reactions to things and acting accordingly. And then it's also helping people deal with their hypersensitivity to evaluation, including criticism or concerns about failure or how that might look to others. So yeah, that grandiosity, the hypersensitivity to evaluation or criticism, addressing the lack of empathy, and this might unfold over a period of time. Often change is gradual. If these are more deep-seated, long-lasting patterns, which they often are. And so a number of people would follow through with therapy to address those areas over a period of at least a couple of years, and not uncommonly longer.
And what are some of the practical ways of managing that?
Yeah, that's a really important thing in the whole CBT, the cognitive behavioural therapy field, looking at some of the specific behaviours that people can change. One of the things is to pick up on exploitative or abusive behaviour. That can include identifying difficulties with anger, anger management can be part of a therapy. It also can be dealing with substance abuse or other ways that people are transgressing in some way. Or it might be discussion of some conflict situations that have come up, for example, in their work life and how they've responded to them, and some feedback and reflecting on that, including their ways of dealing with conflict. It also involves looking at mood regulation. For example, if people have used substances, looking at other ways of managing, for example, low feelings or panicky kind of feelings. Also managing, say, social anxiety or concerns of criticism or evaluation. So strategies for social anxiety are relevant. Sometimes it's picking up on people's all or nothing thinking, that they have to appear a certain way, like ideal, or otherwise it's humiliating. So looking to help people view, for example, success and failure as a more relative or blended way, allowing for mistakes or allowing oneself to be vulnerable as partly a helpful thing in many situations. But part of it is also helping people accept a degree of honest feedback. And that comes up in the therapy setting itself. So it might be titrating that feedback. Initially, it might be more gentle challenges, so to speak. And then as the relationship is developed further, that often gives the therapist more scope to be more direct at times in some of the feedback, but a lot of it also is helping the person recognise that everybody's unique in some way. No one's so special that they meet some kind of ideal. Everyone has feet of clay, so to speak. And so looking to recognise other people's qualities as well, and any ways that promote collaborative or cooperative behaviour, that will help as well.